A post-operative review follows the same format as an ABCDE assessment, but adds in a few extra things to look at related to the operation. Each department may have a slightly different method of doing reviews of their patients, so it's worth checking this when you start your new job.
Hello Jane, my name's Tim. I'm one of the surgical junior doctors looking after you. Just here to find out how you're getting on after your operation. How are you feeling?
I'm okay. Still a bit drowsy.
Alright.
As she's talking to me, I can tell her airway is patent and self-maintained.
Jane, can I just swap those prongs up your nose to this mask? Is that okay?
Yeah, sure.
Do you mind swapping it off? Okay, I'll just pop this over your face. And can I have a little listen to your breathing? Just take some big deep breaths in and out through your mouth for me.
Her oxygen saturations are low, but her lungs do sound clear. She had normal saturations pre-operatively. Her anaesthetic is worn off as she is awake, but she has had intra-abdominal surgery and is struggling to cough, so this is likely the cause for her hypoxia.
Okay, thanks very much.
Alright, I'm going to take a deep breath.
Alright. And are you able to cough? Is that so?
Yeah.
Okay, we'll get you a few more painkillers, I think. Okay, can I just have a listen to your heartbeat while feeling your pulse at your wrist?
Her blood pressure is normal, but her pulse is a bit fast.
Okay.
It'd be worth checking for any bleeding, but pain could be making her tachycardic. She has also been fasting all day and might be dehydrated. She does not have any IV fluids running, but if she can drink fluids now, this would be preferable to IV fluids. The nurses have documented that she has passed urine since returning to the ward.
Alright. Next, I'll just shine a light in your eyes. You can just look straight ahead.
Her GCS is E4, V5, M6, and her pupils are reactive. She has no evidence of post-operative delirium. I could do a brief neurological examination if I had concerns about her drowsiness, but this is likely just left over from the anaesthetic.
Okay, wonderful. And do you understand what they did for the operation?
I had appendicitis. They took it out through keyhole.
Okay. Can I have a look at your belly?
Mm-hmm.
Alright, I'll just lower this down.
Dressings are dry and intact. The abdomen is slightly tender, but not guarding or rigid. I don't think there is any ongoing bleeding or peritonitis. It's too early for a post-operative infection, but that is something we should watch for over the next 72 hours or so. She has no drains or indwelling lines, no urinary catheter, no wound catheters.
Let's go get backward.
Sore here.
That's to be expected. That's where the majority of the work was done.
Okay.
Fine. Okay, well everything's looking really good. Do you have any questions?
Can I have anything to eat?
Let me just have a quick look at the op note. Yeah, they've said you can eat and drink whatever you'd like, but I suggest you start slowly, alright?
Okay.
I think that we should check her blood test tomorrow to look for any post-operative acute kidney injury, rising markers of infection, and a full blood count to check that she has not lost too much blood. The surgeons have also said that they would like her to get a dose of low molecular weight heparin tonight to prevent a venous thromboembolism. I need to prescribe her some analgesia. I'll start with regular paracetamol and dihydrocodeine, as she has no past medical history and is at low risk for acute kidney injury. I will prescribe her also some dihydrocodeine 30mg 4 hourly as required, up to a maximum of 120mg, and oral morphine solution 10mg 1 hourly, up to a maximum of 60mg based on her body weight. I should also prescribe her some antiemetics, as some people get nauseated with opiate analgesia, and as a result of the anaesthetic. Laxatives should also be considered if she is taking several doses of the opiate-based painkillers a day, as she will get constipated. If her pain is not controlled with this, I should come back and re-examine her, and if I've got concerns, I'll ask my senior to assess her. A post-operative review is a methodical assessment of patients who've undergone operations so that any issues can be identified early. Simple things like pain, urinary retention, or dehydration can be dealt with by yourself without any issues. However, more serious things like arrhythmias, wound issues, or pneumonia require early recognition and appropriate intervention. It's important you look at the anaesthetic chart and the op note, as this is where you'll find all your post-operative instructions. These are things like eating and drinking status, mobilization status, post-operative doses of low molecular weight heparin or antibiotics, and any plans for further surgery. If you've got any concerns, it's really important that you escalate appropriately to your seniors, and preferably the people who did the operation, as early intervention improves outcomes.